organization, this week is very, very important because it brings all the people that need to sit together and we chart forward the Africa we want. This is the Africa that recognizes and also realizes that for us to deal with issues of drugs, we need to come together in forums like this to talk about issues that we need to talk about as Africans in Africa and try to find African solutions on issues that affect the continent and the people that are citizens of this continent. That's why this week is very critical and it is very, very thought of and progressive in the Africa we want as we go forward to realize the AU Agenda 2063 as well as AU Social Agenda 2063.
For us, it's a place where we get to understand what is happening in Africa in terms of policy on drugs, get to learn about what other countries are doing, how they went about doing it, and try to see how we can take that back to our country to see how we can also push for the things that we want to be done in terms of drug policy in our country, which is mainly about decriminalization of drug use and possession for personal use, and then also to, interact with the policymakers and other participants that are here and build that alliance that we can, move policy in Africa in the right direction.
It means a lot because you see, I'm an advocate. I push for the rights of people who use drugs, and I'm very happy that right now we are saying put people first. So I would really want that we publicize this and we use this. Personally, I'll use this a lot in the future because I'm learning a lot. I'm learning in terms of advocacy tools. Where can I find them? Right now I came from a session that was talking about decolonizing drug policy. This is the conversation we need to have. Like, where can we get the tools to use with our members of parliament, with our community members? So yes, getting the resources, sharing of course as well what is happening in Kenya, but also learning in what is happening in the whole of Africa.
It's a very, very important event that we get to be a part of, especially because for sex workers we are advocating for the decriminalization of sex work. So what we're advocating for really is there has to be a radical change in policies and the laws in order to protect key populations and also to address the issues, health issues and social issues that sex workers face. So our position is that we can't really achieve any of the global aid strategies or any of the goals standard the SDGs. We can't achieve any of that if we still have a criminalized system for sex workers. It's a really important space because then we're able to push our message for decrim to really get them to understand what decrim is and why it's so important. So we really do hope that we'll be able to, it'll be a ripple effect where we have this policy summit here, and then even when we go home that the impact can also be felt in the communities.
This is a great opportunity for community experts to come together to discuss what has been an ongoing problem for decades, and that is how to better respond to drugs and drug markets in the region.
As the African Union, and especially the Commission and the Secretariat, that is the Secretariat where I come from, we have got these beautiful policies and strategies that we need to look at and be able to work around them and implement them. And also implement them based on human rights approach. Not only that we need also to realize that the solutions about issues regarding drug control and etc., they are within our reach and they can only be dealt with within this continent with less and less support coming from abroad, so that we may use our own strategies, we may use our own resources, both financial and human, and also our intellect to address the issues of drugs. We have reached a stage whereby we have to sit down, converse, talk, discuss, and find solutions that will work within the continent, the regions like SADC, ECOWAS, ECAS, EAC, as well as within at national level, even within the country, as per provinces or districts, villages, towns, because things are different and the way people use drugs is different. And drugs, of course, like cannabis, has been used for centuries in this continent. Why can't we go back and find out how our forefathers and our founders use drugs like cannabis as an example, but be able to be surviving and be able to be who they are today without incarceration and without being punitive going forward?
I would want to tell the authorities is that harm reduction is catching on, and also we understand that the world is moving towards the criminalization of drug use, especially cannabis, and for a country like Nigeria that is still a low middle income country, I think decriminalization and maybe legal regulation of the drug trade in Nigeria and drug production in Nigeria will be more beneficial to us than putting all the money that we have into criminal justice systems and law enforcement that take the rights of people, to bodily integrity, the rights of people to freedom, and further impoverishes or even makes the situation of human rights of people, worse. So we should look at decriminalization of drugs. Maybe we can start by looking at what quantity people can possess for personal use, and then progressively move ahead to other models of decriminalization. And also the tax from it could also help a country like Nigeria grow.
You need to listen to the experts, and the experts are people who use drugs. If you want to know what's going on in the drug market, people who use drugs are among the first to know. They're the experts in what is happening, how drugs are being used, what drugs are being used. We need to stop bringing in other types of experts and listen to the people on the ground first. They need to be central components of the development of any drug policy and drug strategy. They also need to be key partners and central components of the monitoring, implementation, and evaluation of these programs as well.
In order to address, health issues, gender-based violence in the country, we have a bill that is now we're trying to get it into Parliament, but there seems to be, so many delays and snags that are really hindering our progress. And so what we're calling is for the Department of Justice to continue to prioritize our bill, and we're calling on the South African national government because they do understand the decriminalization is already in policies. It's there on paper. They do understand the importance of decrim. So why is it taking so long, and why is there a delay? So that's my primary message. It's let's push for decriminalization of sex work.
Criminalizing people for drug use doesn't work. Actually, it causes so much harm. Former presidents, current presidents, senior people in authority, the UN agencies are telling everyone it does not work. Even governments know it does not work. So the message I would have for them is decriminalize drug use, decriminalize possession of drugs for personal use, because what it does is it increases vulnerability, it increases the rate of HIV among people who inject drugs and people who use drugs. So let us decriminalize drugs because it is what works, and harm reduction works. So it's a right. People need to be given their right, and if we continue criminalizing drugs, people will not come out for services. So by not decriminalizing drugs, even if we give harm reduction services, we will not reach the people we are targeting. So decriminalize drugs.